Hey there, fellow viewers. Welcome back to our channel. Today, we're diving into an incredibly important topic that affects millions of lives worldwide: malaria. And more specifically, we'll be discussing an innovative approach to combating this deadly disease through genetic modifications. But hold on, before we jump in, don't forget to hit that subscribe button and ring the notification bell to stay updated with our thought-provoking content. 1. The Malaria Challenge. Malaria has been a persistent global health challenge for decades, causing hundreds of thousands of deaths annually, primarily in Sub-Saharan Africa. The disease is caused by Plasmodium parasites transmitted through infected mosquitoes. Traditional methods like bed nets, insecticides, and antimalarial drugs have made significant strides, but the battle is far from over. 2. Genetic engineering. A new hope. Enter genetic engineering, a cutting-edge field that offers us a fresh perspective on eradicating malaria. Scientists have been exploring ways to manipulate mosquito populations through genetic modifications to reduce their ability to transmit the disease. One promising method is called gene drive technology. 3. Gene drive technology explained. Gene drive technology involves modifying a specific gene in a laboratory and then introducing it into a population of mosquitoes. This modified gene is designed to spread rapidly through the mosquito population, altering their ability to carry and transmit the malaria parasite. Imagine the potential: by modifying the genes of a relatively small number of mosquitoes, we could significantly reduce the number of disease-transmitting insects. 4. Benefits and concerns. The potential benefits of using gene drives for malaria eradication are immense. It could be a game-changer in disease control, potentially saving countless lives and reducing the burden on healthcare systems in affected regions. However, there are also concerns. Modifying entire populations of organisms raises ethical, ecological, and safety questions. What if the modified genes inadvertently affect ecosystems or have unintended consequences? 5. Ethical and ecological considerations. It's crucial to weigh the benefits against the risks. Experts are working tirelessly to ensure that any genetic modifications are safe and well regulated. Ethical discussions are ongoing about the right to modify entire species and the potential consequences for future generations. 6. International collaboration. Eradicating malaria is a global goal. International collaboration is key to developing and implementing responsible genetic modification strategies. Governments, NGOs, scientists, and local communities must come together to make informed decisions that prioritize both human health and the environment. 7. Conclusion. In conclusion, genetic modifications offer a revolutionary approach to eradicating malaria. While the promise of significantly reducing the disease's impact is exciting, we must approach these technologies with caution and respect for ethical and ecological considerations. By fostering international cooperation, we can work towards a future where malaria is no longer a threat to our world. And there you have it, folks. If you found this video informative and thought-provoking, don't forget to give it a thumbs up and share it with your friends. As always, we appreciate your support and look forward to your insightful comments in the section below. Until next time, stay curious and keep making a positive impact.
Malaria is a mosquito-borne infectious disease that affects humans and other animals. It causes symptoms that typically include fever, tiredness, vomiting, and headaches. In severe cases, malaria can cause jaundice, seizures, coma, or death. Symptoms usually begin 10 to 15 days after being bitten by an infected mosquito. If not properly treated, people may have recurrences of the disease months later. In those who have recently survived an infection, reinfection usually causes milder symptoms. This partial resistance disappears over months to years if the person has no continuing exposure to malaria. Malaria is caused by single-celled microorganisms of the Plasmodium group. The disease is most commonly spread by an infected female, Anopheles mosquito. The mosquito bite introduces the parasites from the mosquito's saliva into a person's blood. The parasites travel in the blood to the liver, where they mature and reproduce. 5 species of the parasite Plasmodium can infect and be spread by humans, with most deaths caused by P. falciparum. Malaria is typically diagnosed by the microscopic examination of blood, using blood films, or with antigen-based rapid diagnostic tests, although PCR tests are not widely used in areas where malaria is common, due to their cost and complexity. The risk of disease can be reduced by preventing mosquito bites through the use of mosquito nets and insect repellents, or with mosquito control measures, such as spraying insecticides and draining standing water. Several medications are available to prevent malaria in travelers to areas where the disease is common. Occasional doses of the combination medication sulfadoxine and pyrimethamine are recommended in infants and pregnancy after the first trimester in areas with high rates of malaria. Despite a need, no effective malaria vaccine exists, although efforts to develop one are ongoing. The recommended treatment for malaria is a combination of antimalarial medications that includes an artemisinin. The second medication may be either mefloquine, lumefantrine, or sulfadoxine pyrimethamine. Quinine, along with doxycycline, may be used if an artemisinin is not available. It is recommended that in areas where the disease is common, malaria is confirmed before treatment is started, due to concerns of increasing drug resistance. The disease is widespread in the tropical and subtropical regions, in a broad band around the equator with 216 million cases in 2016. Resulting in an estimated 445,000 to 731,000 deaths. Approximately 90% of both cases and deaths occurred in Africa. Rates of disease decreased by 37% between the years 2000 and 2015, but increased from 2014, during which there were 198 million cases. Malaria is commonly associated with poverty and has a major negative effect on economic development. For instance, in Africa, it is estimated to result in losses of $12 billion a year, due to increased healthcare costs, lost ability to work, and negative effects on tourism.